My first step when I approach the scene is going to be to determine the scene safety. I'm going to do this by evaluating hazards around the scene and seeing if they pose a threat to myself, to my partner, to the patient, or to any bystanders. Right now I can determine that they do not. My next step is going to be to wear any personal protective equipment that I need, and also to assess the scene again to see if I need any additional resources or if I need any advanced level assistance. Right now I do not. So now what I'm going to do is determine whether the patient is a medical patient or is a trauma patient. Based on information I have from dispatch and from various bystanders, I can determine that the patient is a trauma patient, which indicates to me that I'm going to be looking for a mechanism of injury and not for any kind of nature of illness as I would if he were a medical patient. My next step is going to be to perform a general assessment. So from my general assessment, I can tell that he is a 20-year-old male and that he is unresponsive or sick. What I'm going to do now is have my partner immobilize his cervical spine in case he has any type of spinal injury, and I'm now also going to perform an exam just to see if he has any obvious life-threatening injuries. I have now determined that he has no obvious life-threatening injuries, and I'm going to move to the next stage of my assessment.